Hi, my name's Joe Cuthbertson. Welcome to the World Association of Disaster and Emergency Medicine. This is our fourth podcast on COVID-19. Tonight we're talking to Dr. Luca Ragazzoni from Italy. Luca's a well-respected he's one of the family in Wadham. He's a member of CRIMIDM, the Research Centre in Emergency and Disaster Medicine. And he's really sort of been, part of the core board of members for Wadham for some time now. And we're really looking forward to understanding his perspectives around the impact of COVID-19 in Italy. So welcome, Luca, to the podcast tonight.
Thank you very much for the kind invitation. It's a real pleasure for me to be here and discuss with you, Joe, and to share my experience and my current knowledge in responding to the COVID-19 pandemic with all the WADM members.
Thanks, Luca. We really appreciate your insights tonight, and we really understand and feel for the impacts that have occurred in Italy as one of the primary centres that have been impacted by COVID-19. And from a personal perspective in Australia and participating as a paramedic and leader in emergency management around COVID-19, we're really interested to understand what your and your colleagues' clinical findings around what COVID-19 has presented like within the patient population. I was wondering if you could sort of talk us through how COVID-19 has presented within patients that have attended healthcare centres in Italy when affected by this impact.
Of course. So I would like to discuss this specific issue. Italy, despite having an advanced healthcare system, is almost at point break right now. So the situation here is very critical. Patients are being treated in hospital corridors. Hospital departments have been converted to treat only COVID-19 positive patients, and many doctors and nurses are working outside of their field of expertise. So, and we are not able to provide the same quality of care as we usually do. Of course, now we know that ICU, the intensive care unit, is one of the most stressed hospital unit. However, what is concerning me is that there is not enough attention to the pre-hospital setting. So primary health care, family doctors, EMS have a key role to alleviate the burden at the hospital before the admission. So in fact, what we are seeing right now after the first waves of patients, we are seeing that implementing an important pre-hospital care system involving family doctors, involving the public health sectors is working very well to diminishing the admission of patient, and of course the severity of the patient in the hospital. So we are seeing that, for example, in terms of clinical treatment, it's very important to start very early the treatment with the chloroquine at home. So we are seeing that chloroquine is an important drug to limit the spreading of the disease and to diminishing the severity of the disease. Another important experience that we are having here in this case, not at home, but in the hospital. So we are seeing that, for example, corticosteroids are an important treatment to reduce the severity of pneumonia caused by COVID-19. So to summarize, in terms of clinical situation, so hospitals are overwhelmed, people healthcare professionals are working very hard, and also outside their field of expertise. We are not able to maintain the same quality of care, and chloroquine and corticosteroid seem the real important treatment to reduce the severity of the disease. Chloroquine as a early treatment at home, and corticosteroid used in intensive care, and to reduce the severity of pneumonia.
Thanks so much, Luca. Like for healthcare workers around the world, understanding or getting some insights into what's working and not, and what's helpful in this space with the novel disease is so important. So I really appreciate your insights into that. One of the challenges that we face globally is around PPE practice for healthcare workers. What's been the Italian experience in relation to PPE practice across healthcare?
In Italy, we are facing, as other countries in the world, a lack of PPE. I will give you some example of what we are facing now in our hospital. So every day, the administration sending us a few N95 masks that we need to use for the day. And every day they are supply us with few masks to treat COVID-19 positive patient in our intensive care unit. And this is the same issue is happening in the other wards, where not severe patients have been treated by my colleagues in other departments. And of course, the same situation is happening outside the hospital. At the very beginning, family doctor lack of PPE, and they assessed at home suspected cases without wearing the appropriate PPE. Fortunately, so after a lot of donation from private sector, from the community, the situation is a little bit better, especially outside the hospital. And now the family doctors and the primary healthcare system, they are able to see and manage patients with appropriate protection. However, it still remains a real problem, and this is one of the main issues that we are managing every day. Another example is that the Italian Civil Protection Department in Rome, which is in charge for the overall national coordination, after a few weeks after the first suspected case in the north of Italy, they hired an ad hoc expert in managing and in buying PPE. This person is not a medical doctor, is not a coordinator of disaster, but is especially a person with a specific expertise in dealing with the private sector in import and export activities to buy and to supply all the region and all the health facility with the correct and appropriate PPE. In my opinion, one of the most important problem we had at the beginning was the lack of training regarding the correct use of the PPE, and this was seen not only in a specific hospital department, but also in the pre-hospital setting.
Thanks, Luca. That's really valuable advice. For our perspective around the world, are there any early lessons that Italy has managed to identify that could guide colleagues in emergency medicine and disaster medicine in particular that you've seen so far?
I would say three main aspects: stronger containment measure, stronger coordination between health sector, and as I just said, more just-in-time training. So no healthcare system can sustain an uncontrolled outbreak, and stronger containment measures are now the only realistic option to avoid the total collapse of any healthcare system across the world. All government must act now, implementing traditional public health response tactics: isolation, quarantine, social distancing, and aggressive lockdown. And of course, all people must know the basics of infection prevention and control measure, and all the precautionary measures aimed at avoiding the collapse of the healthcare system and unnecessary loss of life. Also, for my perspective in Italy, we need more and stronger coordination between the different health sectors, from the pre-hospital to the hospital. More coordination between family doctors, EMS, and hospital to contain the admission of patients in hospital and to continue the care at home after the discharge. As I said already before, we are seeing a huge change when we have implemented a coordinated system to early treat patients at home with the right treatment. So we are containing a lot together with the aggressive lockdown, the spreading of the disease. Of course, I would like to spend again a few words regarding training, since it's my field of expertise. I would say that we need more training, more just-in-time training, not only in donning and doffing PPE, but for example, we need to increase knowledge about triage, about ethical dilemmas in difficult situations, and these are specific topics addressed by our discipline, our disaster medicine discipline. And of course, again, basic principle of infection and prevention control throughout the health professionals. I'm seeing a lack of knowledge and a lack of skills in using the correct PPE. So we need to advocate for more training in all this specific domain.
Thanks, Luca. Some really powerful and important messages there. Further to that, as a healthcare worker yourself and for healthcare workers around the globe that are responding to this threat, do you have any messages that you'd like to pass to them at this time?
Yeah, I would like to say that we need to advocate for the inclusion of disaster medicine principles in all the medical schools, in all the nursing school, in all the health professional schools. So we need to understand that this pandemic, this global disaster, is because we are lacking of knowledge of these specific principles. So we need to stay together and to advance our discipline, because it's a science, is a discipline based on science, and we need to move forward our discipline to engage more health professionals all over the globe. So to avoid the impact of the next disaster, and of course to decrease the possibility of having another pandemic such this one.
Thanks, Luca. Some really important messages for all of us as healthcare workers across the globe. And it's a difficult time for us and for many populations. So thanks so much again for your time tonight. It's been really valuable to listen to you and to hear about the first-hand experiences of what's been occurring in Italy, and gives us the opportunity to learn and to consider what our plans are and how we are responding within our own context to COVID-19. So thank you, Luca, and I hope to catch up with you again soon.
Thank you very much again for this opportunity. I think it's very important to share knowledge and experience in this specific moment. And I see that this current podcast is an example of what I see as a particular strength during this current pandemic. We are sharing knowledge, we are sharing experience, and we can teach others and explain others how to prepare in advance. Thanks a lot again.
Excellent message. Take care, everyone, and I'll see you at the next podcast. Bye-bye.